Hello, my name is Sasha Ali and I'm a nurse practitioner here at the Homerton Hospital working with people diagnosed with cancer. I am here today to introduce this film which is going to explore how you can improve your health and well-being after treatment for cancer. The film is for people who have been diagnosed with cancer and are now coming to the end of their treatment. The film focuses on three main areas: exercise, diet, and coping with the transition to life after treatment. We will also provide you with information about some of the resources available both here at the hospital and beyond. During treatment, people tell us there's often a high level of support from health professionals and services, but when treatment has ended, that support decreases. This point in time can feel challenging when family and friends are relieved treatment is finished and may have an expectation that things will return to normal. People often say they feel worse at this time than they did during the treatment, and it has been described as feeling like a cliff edge. We hope this film will provide you with some useful tips to improve your health and increase your sense of well-being during this time of transition and into the future.
So I was diagnosed in December 2015 with triple positive breast cancer, and I went on to have a mastectomy, chemotherapy, and then tamoxifen and Herceptin afterwards. I finished treatment in June 2016 and I went back to work in September. So yeah, that's my story. So many emotions. It's delighted, terrified, excited, pretty much every emotion. I think I'd never really spent much time in a hospital before. I'm not a great fan of hospitals, but actually not coming to the hospital was probably the hardest part, and not seeing the nurses and not seeing the doctors and kind of feeling that I was starting a second part of the journey, and so that was an unexpected feeling. Exhausted probably as well, but also hopeful, really hopeful for the future, and I'm proud. I think there's an awful lot of information. As a younger woman, I was interested in things like look good, feel better, learning about my diet, learning about getting my fitness back, even small things like learning about how I could make my hair grow faster. Just all those sort of more practical things were interesting to me, and also having not self-help, but some books to sort of and thoughts and ideas for thoughts about how I could reframe my experience and move forward. I found that quite helpful. I think my relationship with my breast care nurse was probably the most important part of my journey, because I knew that she was always there and she would answer any questions I had, however big, however small, and I knew that she'd always be honest with me, and she was someone to turn to. What I found was that Google was not the right place to go to, and actually the right place to go to is the professionals. So I always knew that if I was feeling a bit stressed or a bit nervous, actually the right place to go to was my breast care nurse to then talk about whatever was going on.
So when we talk about exercise or physical activity, what we're referring to is moving your body, using your muscles to a point where you're getting some physical exertion. So more than just sitting on a chair, you're actually moving and doing things. So it doesn't necessarily just mean going for a run or going for a bike ride. Walking up and down stairs can be counted as exercise. Carrying some heavy shopping bags, that's also exercise. So I think it's good to bear, there's different intensities of exercise, and it's important to bear that in mind as well. When we think about exercise, it's also, as well as intensity, we also think about the different types of exercise. So there's aerobic exercise. So that's the exercise you do when you get short of breath, you feel your heart going. So it's really exercising your heart and lungs, which is your cardiovascular system. On the other side, there's anaerobic exercise, and that's where it's more your doing strength training, balance training, flexibility. So something that's exercising your body in a different way to aerobic exercise. So when it comes to recommendations about how to approach exercise, the advice is that as adults, so that's anyone over the age of 18, we aim to try to do 150 minutes of moderate intensity exercise a week. So that's working at a level where you're getting short of breath, but you're still able to hold a conversation. Those 150 minutes can be broken down into 10-minute chunks. So I think particularly if you haven't exercised in a while, or if you've not actually tried to exercise before, having it in 10-minute chunks can seem a bit more manageable. So trying to build that up to 150 minutes over a week. The other option is you can do 75 minutes of vigorous activity a week. So that's working at a level where you're getting your heart rate going, getting short of breath, that you're not able to easily hold a conversation. So that's things like running, cycling, swimming, those kind of exercises might be considered a bit more vigorous. So for those ones, 75 minutes is what you're aiming for a week. So you can either do a mixture of both, or moderate intensity or vigorous intensity. When recovering from cancer, the exercise recommendations are very much the same. But I guess the things you perhaps want to bear in mind is it's very individual. So rather than trying to push yourself to work really hard and do an hour walk, maybe it might be better to do the 10-minute chunks, and even if it's just getting off the bus, stop early, and then gradually building yourself up. So there are many wide reported benefits for exercise. So there are huge benefits for your health. It can have an impact on reducing your risk of getting certain conditions, like diabetes, or helping you to maintain a healthy weight. There is evidence that it can also reduce the incidence of certain cancers as well. Then along with those physical benefits, it can even help with things like helping to have a good night's sleep, with managing stress, and I think in particular for people who have had cancer, there's evidence that shows it can really help with quality of life, and even managing things like fatigue, which can seem a bit counterintuitive to try and get your body to exert itself more, but it can help you feel energised and help with managing fatigue, particularly when recovering from cancer. Exercising after having cancer can feel quite daunting. And you would want to make sure that you're going to be doing it in a safe way. So if you do have any uncertainties about what you should be doing or how to approach becoming more physically active, then do seek help from your healthcare professionals. Things that we would usually advise people to bear in mind, if you've had a cancer that's affected your bones, you perhaps want to be quite careful of any high intensity exercise. So that if that has impacted you, it would perhaps be good to get advice on that. Also, if you do have low immunity, then perhaps being mindful of where you might be choosing to do certain exercise. So perhaps going to a swimming pool might not be the best thing to be doing. So it's not saying don't exercise, but being aware of how you can adapt what you're doing to make it accessible to you. Other things to perhaps be conscious of is if you do have any changes in sensation, so any numbness or tingling in your hands or particularly in your feet, just being careful with certain types of exercise. So particularly if you can't really feel your feet that well, you don't want to be going for long walks on uneven ground. But again, this is something that healthcare professionals will be able to advise you on. It may be doing particular exercises to build yourself up to that would be an option. So then the final thing to perhaps consider is if you've had surgery to help manage your cancer, there might be particular restrictions for you. So an example of certain types of surgery for breast cancer, there might be certain arm movements you want to be careful of. If you've had cancer on your bowels, that can impact on your core stability. So again, just being mindful of that. But these are all things that your healthcare professional team will be able to advise you on. There are a number of options locally to support people to exercise. One of the really great resources we have is something called Exercise on Referral Scheme. And so this is where your GP or one of your healthcare professionals can refer you to your local gym. And that's where you get to meet with a fitness instructor who's trained to give an exercise program to someone who has a pre-existing condition. So if, for example, recovering from cancer. And then you can follow a structured exercise program that way. And if going to the gym isn't really your thing, then there are plenty of other options. There's something called our parks, which is an organised group exercise in the park. It could be anything from Tai Chi, yoga. So there's usually something there for everyone. There's a lot of local boroughs offer organised walks as well. There's something called the New Age Games. So there's lots of different resources out there to try and find something that's going to excite you and keep your interest in keeping going with your physical activity and exercise. Because there are so many resources available, if you would like to have any more information about how to get involved in physical activity or exercise, please do talk to your health professional involved in your care or our Macmillan Information Support Manager.
So eating well and eating a varied and balanced diet is important to support your general health and well-being. It can also help to reduce the risk of developing any future health complications such as heart disease, diabetes, stroke, or even other types of cancer. Ensuring that your body is well nourished will help you to build and maintain physical strength. It will support your immune system to promote healing and to fight infections. And it will also increase your energy levels for day-to-day tasks and help you to fight fatigue. And it also just gives you a general sense of well-being. So a healthy balanced diet would be a diet that includes all the nutrients, vitamins and minerals. So we're looking at things like protein, which is your fish, milk, eggs, soy products, beans and lentils. Also carbohydrates, so pasta, bread, rice. Fat, so looking at kind of healthy fats, things like avocado, olive oil, and then a range of fruits and vegetables. You can use the eatwell guide, which is available online to help to support you to balance your meals. And I guess things that we're also looking at is trying to minimise processed and high fat, high salt, high sugar foods. Encouraging people to try to eat more fruits and vegetables, and also to reduce intake of red or high-fat meats. You can replace these meats with other alternatives such as fish, chicken, or eggs. For going for whole grain choices as well is important, so looking at things like brown bread, brown rice, brown pasta, and just trying to keep a generally healthy lifestyle, so keeping active, keep moving, maybe trying to stop smoking, and also to stay well hydrated, so drinking regularly throughout the day, have some water, maybe some squash, and teas and coffees also count towards your fluid intake. So it's very common to lose your appetite either during treatment or after treatment. It can also be a consequence of the cancer itself, which can infect your digestive system. So if you do have a reduced appetite, there are some things that you can do to support you to continue to get enough nutrients, especially if you notice that you're losing weight. The first thing that we would recommend is to perhaps relax any dietary restrictions that you currently have. So some people in general try to avoid fatty foods or high sugar foods. So if you avoid these in general, maybe relaxing any of these dietary restrictions and allowing yourself to have these foods, as this can help you to maintain your weight in the short term. Also maybe to avoid using fat-free or low-fat foods. Other things that you can do are avoid drinking with or before your meal, so not filling up on water or juice. Another thing that people find helpful is changing your meal pattern. So instead of having 3 bigger meals, try changing to maybe 4 or 5 small meals and trying to have some extra snacks. So things like maybe that are high in calories and protein. So things like nuts, things with peanut butter in, or a milky drink such as Horlicks or hot chocolate. It's important to focus on protein and trying to have a little bit of protein with every meal. So things like we've mentioned meat, fish, eggs. If you're vegetarian, things like tofu, beans, lentils and nuts. So trying to incorporate a little bit of these foods with every meal. This will help you to maintain your weight, and it will also help you to maintain your muscle mass. So yeah, that's also really important. You're focusing on maintaining your fat stores and also maintaining any muscle that you have. If you still have a small appetite, you can add extra calories and extra protein to your meals, and we sometimes call this food fortification. So you can continue to have your small meals, but add extra nutrients to them. So you're increasing the nutrients of the meal without increasing the size of the meal or the volume. So some tips for this would be to adding extra butter or spread or cheese to things like savoury dishes like vegetables, potato or meat. You can also add extra cream, milk or custards to sweeter dishes, or adding extra cheese and cream to sauces. You could also use vegan or vegetarian alternatives. So there's lots of veggie or vegan cream alternatives and fortified milk alternatives, and also butter alternatives. So things like dairy-free spread can be useful. Also choosing fluids throughout the day that are nourishing sometimes is useful instead of water, which doesn't have any calories or protein. So drinking milk, milky drinks such as Horlicks, like I've mentioned, or trying to have soups. And we'd also encourage you to have those sweet puddings or desserts, which can be really, really helpful as well. Another thing that people find helpful is having a milky drink before bed. It can be quite comforting in the evenings. And again, if you don't drink cow's milk, you can always opt for a fortified plant milk. So the barista style oat milk, soya milk and almond milk are really, really useful. And I'd also like to encourage people to focus on what you've managed to eat rather than what you haven't managed to eat, because you might feel different day to day. You might have a good day and a bad day. So just be patient with yourself. If you are losing weight or that you're worried about your nutrition, please speak to your medical team or your GP. They should be able to offer you extra support, or they may be able to refer you to see a dietitian. If you're already at a low weight, you may have less reserves than somebody else. So using these tips can be really, really useful. And as soon as you start to notice any weight loss, just speaking with your medical team or your GP. So the internet can be quite a scary place, and there's lots of information on there that's not based on scientific evidence. So we would recommend using trusted sources for nutritional information. So you can ask your doctor, your nurse, your medical team if they have any hospital resources on nutrition that can help you. There's also lots of websites like Macmillan Cancer Support, Cancer Research UK. There's lots of information on the NHS website, or also the British Dietetic Association have lots of useful resources that are evidence-based. If you'd like to look at some scientific evidence, we'd recommend looking at peer-reviewed journals and articles if that's something that you'd like to do. So current evidence for diet and cancer suggests a variable diet that is high in calories, so energy, and protein, which are these building blocks of your muscles. If the information that you're reading online is really restrictive, if it suggests excluding entire food groups, for example, don't eat dairy, don't eat fruit, don't eat sugar, or if it tells you to only eat specific foods, such as only eat green foods, or if it make statements such as this will fight or kill cancer, it's likely not trustworthy, and these diets can be harmful and increase your risk of malnutrition and weight loss. So there are lots of myths around cancer and diet, so it would be really good to discuss some of those. One of the first myths is that soy-based foods can cause cancer or make cancer worse. So the evidence suggests that soya foods such as nuts, tofu and soybeans, they contain phytoestrogens. So these are substances that are found in plants that are similar to the hormone estrogen that we produce. Past research in animals has raised concerns about these phytoestrogens and if they stimulate the growth of breast cancer. But current research suggests that eating soy foods is safe for breast cancer and other cancer diagnoses. So there's no need to exclude this food. Other myths that you might see online is that eating certain foods will cure your cancer or fight your cancer. And unfortunately, this is a myth. There's no evidence at the moment that eating excess amounts of any foods, including fruits, vegetables, or drinking herbal teas, can cure or stop the spread of cancer. Another myth that you may see online is that dairy-free diets are good for cancer. So again, this is a myth. There's no evidence that people living with cancer should avoid dairy products. Online resources say that people should avoid casein, which is a protein that's found in milk, and also that they should avoid the hormones that might be present in milk. So although dairy does contain hormones, this is a very small amount compared to the hormones that we produce in our bodies. There's no strong evidence to show that the hormones in milk can go on to cause cancer. So dairy products are a good source of protein, energy and calcium, and also fat-soluble vitamins. And we'd recommend that they are included as part of a varied diet. Another myth that is one of the most common myths is that sugar feeds cancer cells. So this is quite a big myth to unpack. And searching cancer online, you can find some really alarming statements such as that sugar fuels cancer. But this is really a major oversimplification of quite complex science. So if we start at the start and take a look at what sugar is, so sugar comes in many different forms, the simplest being glucose, which is one sugar unit. If lots of these stick together, it forms carbohydrates, which is multiple glucose units. And the bigger these chains get, they lose their sweet taste and they form foods like pasta, rice, and potato. So sugar is in many foods that we eat, and this is a good thing because our bodies need this to do work and to do day-to-day tasks, to keep our lungs breathing and our hearts beating. All of the complex systems in our bodies need this glucose to perform many chemical reactions and to allow our bodies to use this to do the jobs it needs to do to keep us alive. If we don't eat carbohydrates, our bodies will adapt. It will take the proteins and the fats that you eat, break these down into tiny, tiny molecules and build them back up into glucose again so that your body has that energy source to use to allow you to stay alive. If you don't need enough protein and fat, it can actually take the protein from your muscles and take the fat from under your skin and use this to build up these kind of man-made or glucose molecules that your body makes themselves. And that can promote weight gain or weight loss and muscle loss. So it really can be quite damaging to your body. So the myth that sugar feeds cancer was really born from the belief if cancer cells need lots of glucose, then cutting this glucose or sugar out of our diets will stop the cancer from growing. So phrases such as starve the cancer are seen online, but unfortunately it's just not that simple. All of our healthy cells need glucose too, and there's no way of telling our bodies let the healthy cells have the glucose, but don't give it to the cancer cells. So following a diet that is low in carbohydrates, and by cutting out this huge food group, which is a good source of energy, vitamins and fibre, can actually cause weight loss and can be damaging. So this is particularly important for people who are living with or recovering from cancer because some treatments and the cancer itself can already put your body under a lot of stress and promote weight loss. So really this could be damaging and there's no evidence to support this diet. Nutrition is a really important factor for those living with cancer, and while people are going through this, I think trying to follow really strict and restrictive diets can be another added weight or stress to carry around. So I'd like to encourage people to still try to get some enjoyment from their food where possible, and I'd like to encourage people not to be afraid to eat their favourite foods when they feel able to. Try to eat meals with your family and friends again when you are well enough. If you are a loved one of somebody living with cancer, do encourage them, support them, and try to be positive. Maybe try eating with them and be patient with them, but do try not to nag them. It's important to maintain your strength and support through recovery and treatment to maintain your energy levels and quality of life. If you are struggling to eat, if you notice or anyone of your friends or family notice that you're losing weight, if your clothes feel looser, jewellery feels looser, you can try some of the tips that we've discussed already. There's also going to be some resources at the end of this video that you might find useful, but also please let your medical team or your GP know and they can support you or refer you to see a dietitian.
I think people experience a real range of emotions. So some of the emotions people expect, like relief, kind of cautious optimism, and feeling as though things might start to get back to normal. But there's also quite a lot of other emotions that creep in at this point. So people might feel uncertain, they might not be sure about how to live with their chronic health condition, so they might have symptoms from treatment or ongoing new changes in their bodies from cancer which they find difficult to adjust to. They might have fear of recurrence, and having really hoped to get to this point in their journeys and been really excited about getting to the end of treatment, they might be really surprised that actually they feel suddenly as though they've become quite deflated and it's not the experience that they had hoped for. And I think part of that is because people worry that they're going to not get back to normal, not get back to doing the things that they used to do before cancer. And so there's a lot of questioning around, who am I now? When will I get back to normal? What will happen to me? They may also have had a very difficult journey through their cancer treatment, so there may also be experiences of anger, anxiety and trauma related to the treatment itself. And these are all very common, normal emotions. Many people also have quite positive experiences from cancer, which is quite a strange thing to say. But I think it's an opportunity to help people stop and reflect on what's happened to them in their lives more generally, not just the cancer itself, and to think about whether people are living the way they would like to be living. So people often find themselves making quite big changes, changing jobs, retiring potentially, making changes in the way that they live their life. Perhaps they might want to slow down, or they might think, okay, this is the time to do all the things that I'd love to do and not wait and put off important experiences. People tend to cope in two main ways, and I'll talk about avoidance as the first way. So when you have food poisoning and you feel sick, you get sick, you will naturally want to avoid the food that made you sick, and that's normal. When you have a situation like cancer, which affects so much more of your life, it's a bit more tricky because avoidance really works best as a short-term solution or as a really limited solution. So when cancer affects so much of your life, avoidance can have the impact of you start to deny that the problem's there. You might also withdraw and isolate yourself, which can have a knock-on effect on your mental health. So the more withdrawn and isolated you become, the more depressed and anxious you might feel, which actually might mean that you end up making the avoidance worse and making your life much, much smaller. People can cope with cancer and difficulties through avoidance by wanting to go and drink or take drugs, which has a knock-on effect as well, because obviously those things can both affect your health and also serve to make you withdraw further potentially. So the second approach is a more active style of coping. And this is where people recognise that they have a difficulty. And that's really important, I think. So noticing that you're feeling bad on a particular day, maybe feeling quite anxious, maybe feeling quite low in mood, maybe feeling quite cross or not wanting to get up or unmotivated. And rather than running away or avoiding that problem, they might decide, okay, that's how I'm feeling today. And then once you've acknowledged how you're feeling, it allows you to make decisions about what you're going to do about your feelings. So for example, you might say, okay, today I am actually really achy, I'm in a lot of pain, I'm not going to just plough through this, I'm going to let myself have a lie-in. But then after a while you might notice that your mood changes a little bit, you feel a little bit more rested, your mood lightens, and then you can say, okay, time for me to get up and get on with things. Or you might say, okay, actually what I want to do today is I want to get into my life a little bit more, and that's how I'll cope with this. So, okay, I'm feeling rubbish about cancer right now, but I also know that if I go and do things that I enjoy or that I'm good at, that will lift. So those are different kinds of active coping that we can use. Being capable of talking about how you're feeling, so not being scared of talking about your emotions. People often feel worried about burdening others, such as family members, or they feel worried about how they'll look if they admit to difficult feelings, vulnerabilities and things like that. But actually, once they start to share these feelings with people that they trust to be able to listen, they find that actually that really helps with how they feel. It's one of the reasons people come to see psychologists, because they know that that will help them being able to talk about their feelings to someone who can listen. Thinking about coping, I just want to talk specifically for a little bit about fear of recurrence, because that's a huge issue for people. People often find it's triggered around certain anniversaries, maybe birthdays, maybe Christmas, but also around appointment time. So as appointments are coming up, people's fear of recurrence can really heighten, and it can affect everything. It can affect your sleep, your diet, your day-to-day life, how much you want to see people, all of your emotions. It can feel like a real roller coaster. One of the ways that we can think about this is, again, to acknowledge your feelings, to be mindful of how you're feeling. And again, the same things apply as for active coping. So using your active coping skills to talk to someone about how you're feeling, to stay active and to engage with your interests, with the things that you enjoy, and to just allow yourself some time to feel your feelings. I think that's a really important thing to do. So practical ways of coping, we want to think about, first of all, identifying what you need. So it might be that initially after treatment you have lots of physical needs, maybe you still can't walk around as easily, maybe you can't get your shopping as easily. So you might want to think about how you can manage those things, either yourself or by asking friends and family for help. Secondly, you might want to think about, okay, what can I still do? So what am I still able to do without pushing myself too far? Quite often people get into quite difficult cycles where they push themselves too far, and then they find that they're absolutely wiped out the next day and can't move for 3 days. So we want to avoid that. It's much more helpful to build up how much you're able to do step by step and bit by bit. So what I'd encourage people to do is to think about, okay, well, what do I think I can reasonably manage today without completely wiping myself out for tomorrow? And it might be that I decide, okay, I can vacuum one of the rooms in the house today, or I can go for a short walk. And okay, that's not the run I used to be able to do, but that will come. And a short walk is the first step to that. So really not being put off by your limitations, by your body's limitations at the moment, but starting to build up slowly and starting to engage with the activities, with the things that you really enjoyed doing before your cancer. Other things that can help include relaxation and breathing techniques, mindfulness and other forms of meditation are really, really helpful. And there are lots of different kinds of meditations, of breathing techniques, of relaxation techniques. So you might want to use guided imagery. You might want to use something as simple as noticing your 5 senses when you're sitting down. So thinking about, okay, what can I hear? What can I see right now? What can I feel with my hands? What can I smell? And so you're kind of going around noticing what's around you. Very often people find that has a very calming effect. Okay, so I would start with thinking about defining your new normal. So what do you want your life to be like right now? And that may continuously change. So you might have to define, redefine your new normal as you change and as your body changes and as what you can do changes. Secondly, I think expressing emotions using an active coping style is really important, but also making room for positive emotions. So sometimes we forget about that when everything feels very black. Actually allowing ourselves to feel gratitude, courage, enjoyment and pleasure. Those are all important things. They make us much happier when we allow them in. But when we feel threatened, sometimes we forget to notice them. So that's the third thing. The fourth thing I would suggest is adopting healthy behaviours. So checking out, how is my nutrition? Am I eating and drinking well? How is my sleep? Do I have a good sleep routine? Am I going to bed on time? Making sure that I allow myself time to rest. And am I getting active? So am I exercising appropriately enough within the constraints of what I can do? Another thing, so number 5, I suppose, would be live in the moment. So carpe diem, seize the day. You may not feel like you can imagine a future, and going back into the past can feel quite challenging because of everything that's happened. So when we allow ourselves just to sit in the moment right now, right here in this space, it allows us to engage with, okay, what is my life like right now? And my life might not be so bad. I might be drinking a cup of tea and it might be quite nice, and having a biscuit with it, which is quite nice. And okay, I have had cancer, but right now this is okay. And finally, I think it's really important to just allow ourselves to laugh and find opportunities to laugh. And maybe you'll know someone who, really makes you laugh, or I'd encourage you to watch funny films or comedians or whatever it is that makes you chuckle, videos of your kids, because that's something really healing, and as soon as we start laughing, it makes us feel better. So I'd like to introduce you to a brief 3-minute mindfulness space. So this is a technique that we can use at any point. It just takes 3 minutes, as the label says, and all we need is a chair in a relatively quiet space, or you can sit on the floor if you want to, or even lie down. And I'll give you instructions as if you were sitting in a chair. So first of all, we want to think about putting our feet on the floor and making sure that they're kind of planted on the floor. Our hands stay in our laps or comfortably by our sides, whatever feels better. And then we either shut our eyes or lower our gaze down to the floor if that feels more comfortable. So then just noticing what it feels like to be sitting here. Noticing the back against the chair. Noticing the weight of the body and how it sinks down towards the ground. Noticing the connection that the feet make with the floor and that the body makes with the chair. And then very gently moving our attention to our breath. So however you're breathing is absolutely fine. All we want to do right now is just watch our breath. It might be fast, it might be slow. It might be deep or shallow. Just allowing ourselves to watch each in-breath and each out-breath. And noticing the movement of the breath in the body. With each in-breath, our belly rises and our chest expands. With each out-breath, our belly falls and our chest contracts. Spending a bit of time just watching the movement of the breath in the body. And now, widening our attention to include wherever we're sitting in. So you might notice the air against your skin or the light coming in through your eyelids. Or have a sense of the space around. The sounds around. And then, as we come to the end of the practice, just allowing the eyes to gently open.
Thank you for watching our film. We hope that you found it helpful. I would like to take this opportunity to introduce you to other members of the cancer team here at the Homerton. Madhu, who is the Macmillan Information and Support Manager. We also have Crystal and Shirley, who are Macmillan support workers. They are both contactable on the phone number below. They can also help with any administrative problems you may have and can also take messages for members of the clinical teams. Finally, coming up are links to charities and local services which are available to support people who are living with or beyond cancer. Thank you.